Danielle, thanks for joining us.
Yeah,
it's been a year since we talked. You're a regular at our events.
True?
Yeah, it's been about a year. I watched it last night. It's pretty good.
Good for us.
Yeah, very nice. So when we talked about a year ago, you said, well, listen, we've lost some ground because of COVID in this space. So in the last year, what progress have we made?
Yeah, so the good news is on that in particular, we were talking about the missed screenings, about
Yes.
10 million that happened, especially in the early days of the pandemic. The good news is we are back on track.
Okay.
We are back up to pre-COVID levels of screening by most reports. The President and First Lady put a huge emphasis on this early, and the reignited Cancer Moonshot as part of this administration. And with private sector actions, we just did an update. I think it went up this morning. Hopefully it's up. That more than 35 organizations and private sector companies made commitments specifically as part of the Moonshot on this issue. And 1 million people had access just based on those commitments. And that's on top of a number of federal government actions from CDC, committing $1 billion to their cancer screening, reaching every state, many tribal organizations and territories. So we've made a lot of progress on that issue in particular. And last month was the the inaugural cancer screening, let me get it right. Cancer Prevention and Early Detection Month. So we're continuing to put a focus here because we know what a difference it makes.
And yes, I mean, but that doesn't happen magically, right? Earlier this year, employers and labor groups also committed to expanding access to cancer screenings. How does that happen? How do you manage the bureaucracy? You got to work with private-public partnerships, but also government, Congress. How does it all work?
I think the good news, and you heard it earlier, is this is an issue everyone cares about. And while I know we're going to talk about innovation in ways to treat cancer, while that's important, we know what an impact on reaching the President and First Lady's goal for the Cancer Moonshot of decreasing the cancer death rate by 50%. Prevention and early detection are a huge part of that. They've gotten us to where we are today in the progress we've made in the fight against cancer, and that's how we're going to continue to move forward. So it's an easy sell, is what I'm saying. And that the employer and union commitments were really to say, it's on all of us to take part in this. So all of us to get our recommended screenings, but employers and unions said we want to be a part of it and make sure that our employees have access to the knowledge that they need to know what screenings are available and useful to them, access to the screenings themselves, whether that's time off or bringing the screenings to them. So they've really stepped up as part of this.
You know, I always tell our staff that basically when they're writing a story, there's probably going to be, if they remember one thing from the story, that's a good thing. So as far as screenings, how do you convince people? And I just got a screening, and I learned for the first time that you can get skin cancer by driving, by commuting, and you should wear SPF every day. So I bought that, but how do you make the case to people, stop your busy lives and get your screenings?
It's not just one thing, unfortunately. I think talking about it, which you just did, and sharing that you took this action and it was important and you got ahead of something.
My wife was on me. So
there you go.
There you go. Yeah.
Women are often the driver in keeping up with preventative care.
Yes.
But I think it is. It's talking about it and then removing as many barriers as possible. Once we have the knowledge, we're busy, we're taking care of others, we have jobs that might not give time off for this. So working with businesses, working through federal policy to remove as many of those barriers as possible. And I think the other storyline here is the outcomes from cancer are changing, right? A generation ago, 2 generations ago, getting a cancer diagnosis didn't necessarily mean that anything was going to change. Getting it early didn't necessarily mean that anything's going to change. That is not true today. If we detect cancer early for most cancers, many cancers, I'll be safe there, there are treatments that can get people back to their lives or have them live a long time even after a diagnosis.
And as far as that, why is that? Is it just the innovation that we've seen over the last 10, 20 years?
A combination with earlier detection.
Okay.
Right? We now have methods and recommended screening guidelines for many more Americans that are able to catch cancer early when we do have tools that can treat it.
Access to healthcare. When you say cancer screenings, have you seen some of the barriers as far as insurance covering these? Because healthcare is expensive.
Yeah.
Have we made a lot of progress, and where do we need to go on that?
So because of the Affordable Care Act, this was one of the big wins. There's many, I won't go through them all here, but one of the big wins is that preventative services were now covered through all ACA insurance. And so those that are recommended across breast cancer, lung cancer, colorectal cancer, cervical cancer, and others are now covered. So people with insurance should have access to this.
The president has big goals on cancer, and obviously his family's been touched by it. Is his goal of cutting the cancer death rate in half? That's a big goal. Can that be achieved?
It absolutely can be achieved. Like I said, a focus on prevention. We've taken a lot of steps, especially through the Environmental Protection Agency, with the bipartisan infrastructure law, invested billions of dollars in cleaning up toxic Superfund sites and cleaning up our water. We have the first ever drinking water standard for PFAS, so-called forever chemicals
yep.
that we know have an impact on cancer. We just banned the remaining asbestos product that was previously allowed in the United States. So prevention is going to be a huge part of how we get there. Early detection we've talked about. And then driving more ways for people to access the tools we have, in addition to driving more innovation. One example, the First Lady has shown a lot of leadership here, has been in, for the first time ever, cancer navigation services are reimbursable. So through CMS, CMS put out a new rule, so seniors on Medicare who get a cancer diagnosis can have someone walking them through the steps and the decisions and those barriers to care like travel and financial toxicity that we know have an impact on outcomes and really change the game. The American Medical Association stepped up as part of that and said, not just for CMS, but for private insurance, we now have codes that reimburse for clinical navigation services. The First Lady brought in 7 heads of insurance companies, and already 150 million Americans covered by those companies have access to this. So we're making progress in making sure that we're driving innovation. We have ARPA-H, we have incredible resources and advances from the National Cancer Institute and the whole innovation ecosystem. But we're really focusing on how do we make sure that that reaches people, because it doesn't matter what innovations we have if we can't get it to people and they can't access and afford it.
How do we reduce barriers in clinical trials? That's a big issue right now.
Yeah, another one where there's a lot of steps to get there, but we're making progress on many of them. Again, it starts with knowledge and information. And so those navigation services being covered actually impacts this. There's now someone whose time is being respected and paid for to sit with a patient and their family and talk about the next steps. That could open up really important conversations about clinical trials. Another barrier to clinical trials is having data on who would qualify and how to start to do that match. There's great work that started with the 21st Century Cures Act back in 2016. The Office of the National Coordinator for Health IT is having a big meeting out in Bethesda right now that I'm missing to be here. Sorry, guys. But they have been taking steps on having common data elements, agreed upon data that's being entered for every person facing a cancer diagnosis. So now we have a basis of information where we can start to match people even more effectively. And then the third thing is we have to bring care to where people are. And here I mean trials. That barrier that used to exist between care and trials is really kind of getting a little gray and wavy because so many people are accessing, for so many people, the options in trials are better for them because the innovation is moving so quickly. And so we need to make sure that our best cancer hospitals and our community cancer centers have the information, have the ability to help people access those trials.
Speaking of innovation, what is something we didn't talk about a year ago but has exploded since is AI. What are your concerns and maybe hopes for AI? I know a doctor who says AI does a lot of the mundane tasks around the office. He hasn't gotten rid of anybody, but they're able to focus more on the real work as opposed to administrative stuff.
Yeah, I mean, there's been a lot of talk about AI.
Yep.
There's been a lot of talk from the White House about AI. We are very focused on this. The president personally is very focused on this, and my boss, Arthi Prabhakar, has been a leading voice in the administration on this. I think the first thing, and you saw in the AI executive order and other things that came early on, the first focus was, let's make sure that we are taking really important steps early on to mitigate the risks that AI can bring to the American people, and reduce harm. And a lot of those steps are in progress. As we learn more, as the technology develops, we'll continue to take those steps. But now we get to turn and look at, there's a lot of benefits that can come from this. Think about a public health system that is supported by AI and better reaches people early on in an outbreak, or with targeted, culturally appropriate, language-specific information about cancer screenings that the system itself doesn't have the time or capacity or ability to do. But now with AI, maybe we can reach more people with the information we need. All the way through really interesting, that some of the former folks up here could talk about even more eloquently, really interesting scientific applications for AI. One project that ARPA-H, the new research agency for health, that's really tackling the things that the rest of the system hasn't figured out yet, in new innovative ways, just funded a project focused on rare disease. So what if we took all of the approved drugs at FDA and we were able to look through patent applications and all this information that talks about the specific targets that those drugs target. And now we have someone who, a rare disease organization called EveryCure, that has access to information about a number of rare diseases. We could find new matches and new patterns, and potentially be able to repurpose something that's already out there for an application for a rare disease that may never have been found because no one was looking.
What about funding for the Cancer Moonshot initiative? What's the future there? There's been some concerns from the administration on that.
Yeah, I mean, the president continues to ask for really robust biomedical research and broad research budgets, including for the Cancer Moonshot. I think the good news is, despite an attempt to undercut and really decrease budgets across the National Institute of Health and the NCI by some on this side of Pennsylvania Avenue, I think the funding for the National Cancer Institute was mostly maintained. That's never good enough, but I think in this sort of budget environment, that is a good first step, and we're going to work to really continue to move it forward. I think the other thing is we have a brand new NCI director who's making really strategic decisions about how to make the best use of what that funding is while maintaining everything that's already going on. And we can't forget that we do have a brand new research agency for health that didn't exist before, that has a good kind of foundation first kickoff funding that's really making a difference.
How many health agencies are there? And how do you manage that?
So the president created the first ever cancer cabinet. And the idea here was, we think of the Department of Health and Human Services, right? When we think about the fight against cancer and all of their components, the National Institutes of Health, the NCI under that, the Food and Drug Administration, CMS, CDC. I won't spell them all out. We know what they are. And all of them are a part of it. But I think what's important about the approach that we've taken is that's not enough. Department of Defense, Department of Veterans Affairs has a huge role to play here. The PACT Act that passed in a hugely bipartisan way is making a generational difference in the care that we can provide to veterans who were exposed to toxic substances that can now get access to care for cancer and other diseases. But we didn't stop with those that are focused on health systems. The Environmental Protection Agency and the U.S. Department of Agriculture and the Department of Energy, NASA are all a part of this because we know that it's going to take innovation, like I said, from prevention all the way through survivorship and making sure that Americans have access to those.
What's the thing that excites you most about the future of combating cancer?
Yeah, a few things. Okay. One, we need to finish the job and make sure that we do deliver effective navigation services to all Americans. We've made a great first jump in that, but then I saw a lot of people not even knowing when I was talking about that had happened. And so I think we have a lot more to do to make that real for people. I think the other thing is we have a great opportunity to get really targeted based on risk in our screening and early detection that will make a difference in outcomes. And I'm a scientist. I'm a neuroscientist by training. The innovation in new ways to prevent, detect, and treat this disease are awe-inspiring, right? Like every time I go to a conference, you see that the innovations that were being tried out in small places and showing some promise from the conference the year before are now blossoming into many different types of cancer. And I think that system is moving at a really rapid pace, and we're going to have really interesting, less harmful ways to treat cancer and get people back to their lives.
That must be a rewarding part of your job.
I get to watch the scientists do it now. I'm not in the lab anymore,
Right,
but
right.
yes, it's really, really great to see.
Danielle, thanks so much for joining
Thanks
us.
for having me.
Appreciate it.
Appreciate
Thank
it.
you.
Thanks.
Hey, great job. Great job. We'll see you next year.